Hello, I'm Dr. Manisha Shah, Director of Neuroendocrine Tumor Clinic Program at The Ohio State University Baxter Medical Center. I'm also a physician researcher for Translational Therapeutics Program at The Ohio State University Cancer Center, James Cancer Hospital, and Solo Research Institute. In this video, Prognosis, Predicting Patient Survival, I will be talking with you about the meaning of prognosis, factors that predict patient survival, and I will close with the tips for oncologists discussing the prognosis as well as patients and families hearing the prognosis. So I will start with meaning of prognosis. When we use term prognosis in our medical literature, we understand how serious the illness is. So in our instance is cancer. How bad the cancer is, how serious the cancer is, meaning that how long patient has to live. Is it few weeks, few months, few years, or could patient be cured of the cancer? So factors predicting survival, basically I divide that into two groups. One is patient-related factors or host-related factors, and second is cancer-related factors. So I will start with cancer-related factors. So cancer type, for example, matters. If it's testicular cancer versus lung cancer. So patients who have testicular cancers do a lot better, meaning that they live a lot longer, their cancer could be cured, and so forth, as opposed to patients who may have lung cancer. Even within cancer type, the subtype matters. So patients with thyroid cancer, if they have papillary thyroid cancer versus anaplastic thyroid cancer, prognosis would be quite different because papillary thyroid cancer patients again, could be cured of their cancer or could live for decades, as opposed to anaplastic thyroid cancer that could only be, they could live only for a few months or a few years. Second category would be cancer staging or extent of cancer. So for example, breast cancer that starts in the breast, but it has tendency to spread to either lymph nodes, lungs, liver, bones, and so forth. So if cancer is localized just within the breast, and if it's small, we call it stage 1. And we call it stage 4 when cancer is spread to the liver or lungs or other distant organs. So patients who have stage 1 breast cancer, the likelihood that they are alive at 5 years would be 99%, as opposed to stage 4 breast cancer, when likelihood of be alive at 5 years would be only 25%. So in this case, the stage or extent of cancer matters, the prognosis. The third category would be the tumor burden. So even when I have a patient with stage 4 cancer in my clinic, their prognosis could be different. It's the same cancer called carcinoid cancer, stage 4. Both patients have cancer that's affecting the liver. However, it depends on the degree of how much tumor burden there is in the liver. So if in the liver, it's about 10% that's affected by cancer versus 70% that's affected by cancer. So patients who have less cancer in the liver would do better than patient who has a lot more cancer in the liver, even though both could be stage 4 and both could be the same cancer type. The next factor from the cancer perspective would be biochemical or genetic or molecular makeup of the cancer. So there is a type of lung cancer called adenocarcinoma. There are about 10% of patients with adenocarcinoma of lung cancer that have mutation in the gene called EGFR. Now, there have been major breakthrough in care of or treatment of patients with EGFR mutated adenocarcinoma of lung cancer. So these patients have powerful therapy that could combat their cancer, and therefore their prognosis would be a lot better than adenocarcinoma that did not have EGFR mutation. So therefore, molecular or genetic makeup of the cancer matters, the prognosis. And finally, the cause of cancer could matter. So for example, oral cancer that is caused by HPV or human papillomavirus could have better prognosis as opposed to same cancer, oral cancer that's caused by smoking or tobacco use. So in summary, cancer factors including cancer type, subtype, stage of cancer, biochemical and genetic makeup of the cancer, as well as cause of cancers matter. Now, pathologically, when pathologists look at or analyze the cancer specimen, they also issue a report that includes a grade or a differentiation of cancer. So in solid tumors such as lung cancer, neuroendocrine cancer, this particular factor matters. So patients whose cancer or tumor looks pretty happy and organized under microscope, we call grade 1 or low grade or well-differentiated tumors, they are generally slow growing and therefore their prognosis is better, as opposed to very chaotic looking cancer that we call grade 3 or high grade or poorly differentiated, and those cancers do much worse. So now let's turn into patient or host factors. So when we have patient in the clinic, we think of several factors within patient himself or herself, and that includes age, sex, ethnicity, race. It also matters how functional or how disabled they are from their cancer. So if patient is up and about, able to do their routine activities, then their activity level is great and they have not been put down by cancer, as opposed to patients who have very poor activity level because they feel so tired, so exhausted that they are unable to carry on their daily activities. And so patient whose activity level is better, they have better prognosis as opposed to patients who is practically in wheelchair or disabled from the cancer. Also, associated medical conditions matter. So patients who have diabetes or hypertension or heart disease would have prognosis that could be affected by these illnesses. Organ function also would be important because many chemotherapies or treatments could be cleared through either kidneys or liver. And if person has liver failure, then chemotherapy may not be feasible for those patients. So therefore, organ dysfunction also matters, and it affects the prognosis. So finally, I would like to give a few tips to the oncologist as well as patients and families. So as a doctor, giving a prognosis to the patient or families, we have to be cognizant of the fact that we don't really know very precise or accurate prognosis in a given person. So if I have a patient family in my clinic and they would like to know the prognosis, I very much have several scenarios. So one scenario could be that it's very clear the patient would be cured of their cancer because it's black and white, and therefore I am very confidently able to convey to the patient that the prognosis is great. Cancer would be gone forever after this particular treatment. I also could have opposite scenario where I know that cancer is very advanced, it's involving many organs, I don't have any treatment options left, and cancer already has caused liver failure. In which case, the prognosis or life expectancy of a patient could be in few days or few weeks. So in this instance, as a doctor, I'm also very clear that patient has very poor or grave prognosis, and I would communicate such information to the patient in a sensitive manner. However, most of the instances, it's very much a gray zone. So doctor cannot be 100% sure that one would only have 2 years to live or 2 months to live or 10 years to live. So this gray zone needs to be dealt with clarity. So I would explain to the patient that I cannot really predict the prognosis very precisely in your case, but if I had 10 patients in this room that have similar cancer and situation, most patients would be alive at 5 years. And that gives patients some understanding rather than me telling the patient that patient is going to be alive at 5 years or not, because I can't really predict that. And so this is, from oncologist perspective, we need to be transparent, we need to be sharing information that we know, and we have to be honest. We have to share information even though it could be bad prognosis, because patients and families deserve to know the truth. Now, from patient and family's perspective, we have to know that as a patient, do I want to know my prognosis? Do I want to know how long I have? And if so, then I need to be asking my doctor similar questions. Sometimes some culture has practices where patient doesn't even know the cancer diagnosis and they don't want to know the prognosis. Some cultures, some societies do want to know. And so making your thoughts, your questions clear helps the doctor and medical team to know how much information you would like to know. But no matter what, as a patient and family, you have to know that doctors not necessarily know the accurate, so all they're giving you is estimates. and very much a ballpark estimate. Therefore, if I have a patient, or if I'm a patient and I'm told that I have 3 years to live, that necessarily may not be true. And therefore, I could live for 5 years, 10 years, or I could live for 2 years. And that uncertainty is very difficult to acknowledge. However, once we acknowledge, it's easy to get through. And there is always a hope and attitude that matters. So the factors that affect the prognosis, though it's not written in the books, based on our experience and expertise, we see it every day as a medical team that patient and families' attitude towards their cancer helps them quite a bit getting through the journey of cancer. So in summary, if I can get one sentence message across about prognosis, is that prognosis basically means outcome for the illness. And the prognosis in most instances is uncertain, and it's only an estimate. Thank you for watching.